Hello to all. I am Marcela Bardin, and I thank ICS for the opportunity to present this study, which was mentored by Professor Dr. Melanie Morin. We acknowledge the Canadian Institutes of Health Research as a funder of this study. We all know that physiotherapy is suggested as a first-line treatment for provoked vestibulodynia. And despite that, the available evidence is revealing strong treatment effects of physiotherapy for women with PPD. There are currently no data available investigating factors that could influence or moderate the response to treatment. In other fields of medicine, as such influence has already been demonstrated. For instance, in psychotherapy, the therapy support is known to play a very important role in the improvement of the patient, surpassing the therapist experience. On the other hand, the experience of the surgeon is highly related with better performances and thus with better patient outcomes. When delivering physiotherapy, one may need both skills, but whether the role of the physiotherapist is moderating the response to treatment of women with PPD remains unknown. So our study aimed to examine the associations between the therapist support, the physiotherapist experience, and the improvement in pain and sexual function in women with BVG receiving physiotherapy for the pelvic floor muscles. This study is embedded in a larger randomized clinical trial treating women with BVG with either multimodal physiotherapy or lidocaine, but only the data pertaining to women who underwent physiotherapy was used in this study. So nulliparous women aged from 18 to 45 years old who were diagnosed with PVD following a standardized gynecological exam proceeded to multimodal physiotherapy, receiving education, manual therapy, and use of dilators. The physiotherapists involved in this trial had all completed their postgraduate courses in women's health and chronic pelvic pain, and had received an extensive and standardized training about PVD and the study treatment protocol. So women were assessed at baseline, at 2 weeks after the end of the treatment, and again at 6 months follow-up. In all of those assessments, they were asked about their pain intensity according to the numerical rate scale. They fulfilled the MPQ questionnaire in order to assess their pain quality, and they answered to the female sexual function index. After receiving 10 weeks of physiotherapy once a week, they also fulfilled the interpersonal behavior scale short form in order to be assessed the support to patient. In other words, this tool was assessing the sense of care, the sense of self-competence, and the autonomy support the patients feel to have received from their physiotherapist during the treatment in the trial. So they were totally disagreeing to fully agreeing with phrases such as, I feel that my therapist is concerned about me, or my therapist gives me feedback about my progress. Finally, physiotherapist clinical experience was assessed by the number of days worked per week. So 2 different physiotherapists who would be working 1 year, they could differ from each other if one was working 1 day per week and the other, for instance, 5 days per week. As results, we found that the therapy support perceived by the patient was associated with greater improvement in pain quality and sexual function from baseline to post-treatment. In other words, that meant that the more supportive was the physiotherapist, the greater was the improvement in pain quality and sexual function of the patient treated by that supportive physiotherapist. Multi-level modeling analysis revealed that physiotherapist experience was not associated with treatment response. But here it's important that I remind you that that was in a context where physiotherapists received that extensively training to deliver a very specific protocol of treatment. In conclusion, this study suggests that future clinical research and practitioners focus on quality of support given to patients when treating women with PPD in order to increase effectiveness on improving the outcomes. I thank your attention very much.